Alright, today I'll be performing my head to toe assessment. I have a few equipment, gloves, medical asepsis, a pen light, my blank sheet, my blank outline. Okay. So I'll go ahead and start by introducing myself to the patient. Alright, I'm Alexia Wilkinson. I'll be the student nurse taking care of you today. Do you mind verifying your name and date of birth? So she would verify her name and date of birth. And I'd ask if she has any allergies. And she doesn't. So I'd visually assess that she had no ongoing therapies like IV Foley catheter, peg tube, or anything like that. So today I'll be performing a head to toe assessment. It's going to be about 30 minutes. Do you think you need to use the bathroom or anything like that? No, she doesn't. So are you in any pain today? On a scale of 0 to 10, what would you rate that pain? 0 being no pain at all. 0? Okay. I mean 3. So she rates her pain a 3 out of 10. We'll go ahead and get that taken care of for you today. Do you mind? I'm just going to ask you a few more questions. Can you tell me what year it is? 2020. The President of the United States. Okay, and can you tell me where you're at today? And she knows she's at the hospital, so that her mental status has been checked. Next, I'll go ahead and, now that all that's good, I'll go ahead and perform medical asepsis. And go ahead and put my gloves on. Okay. So I'm just going to visually inspect her head, that she has no hair loss, any alarming abnormalities. I'm going to assess her face for symmetry, color, size, equalness on both sides, any color abnormalities or things like that. And I don't see any, so I'm going to go ahead and start by assessing her cranial nerve 7 by asking the patient if she can go ahead and wrinkle her forehead. And she can do that with ease. I'd say, can you clench your eyes closed? She can do that with ease. And if she can smile or puff her cheeks out, and she does that all with ease. So her cranial nerve 7 would be intact. Next, I'll go ahead and physically palpate her head, her hair, for any hair loss, lice, look for any lice, and any lumps, nodules, and the normal bony prominences, and that's all for that. So then I'd assess her face a little bit more. I'd assess her maxillary sinuses and her frontal sinuses, and I'd ask if she has any tenderness in these areas, and she doesn't. So her head and face are intact. So next I'll go ahead and assess the eyes, and I'll visually inspect for any drainage, any puffiness, and I don't see any, so I'll go ahead and assess her cranial nerve 2, which is her vision, and I'll just go ahead and ask, can you read this first line for me? And if she's able to do that, then her cranial nerve 2 is intact. Next, I would assess her cranial nerve 3, 4, and 6. And this is basically testing the muscles of the eyes to see if, and to make sure there's no involuntary shaking of the eyes. So can you go ahead and look at the pen light for me without moving your head? Normally I wouldn't be behind the patient. All right, and that's all in check. I didn't see any involuntary movement of her shaking of her eyes. So next I'm going to go ahead and assess Perla, which is pupils, equalness, round, reactive to light, and accommodating to. Okay, so I'll go ahead and assess that her pupils do react equally to light, and they both constrict. So her light accommodation would be intact. So they are reactive. So next I would assess accommodation, which right now her eyes would be constricted looking at the pen light, and if I put it farther in the distance, they should dilate, which they do. So next I'll go ahead and physically palpate around the eyes, specifically the lacrimal ducts under the eyes and the eyelids for any tenderness and anything like that. I don't see any drainage or anything. I'll also go ahead and check her eyebrows for any hair loss, lice, anything like that. So it's all good. I don't see anything. So next I'll go ahead and assess her nose, and I'll physically and visually inspect that it's aligned, it's symmetrical, and possibly any drainage if it's there. So I'm going to assess cranial nerve. No, it's not a cranial nerve. I'll just assess her patency, which she would occlude one nostril and breathe in, breathe out, and I shouldn't hear anything. So next, I would assess possibly her cranial nerve 1 to see if she can smell. And to do this, she'd close her eyes. I'd give her something to smell, and she'd tell me it was a stinky shoe. So her cranial nerve 2 is in check. Next, I'd go ahead and palpate her septum, the bridge of her nose, around the nose, anything like that for tenderness, alignment, or any abnormalities that shouldn't be there. So okay, after that I would assess the mouth and the oropharynx. So to do this, I would visually inspect for any dryness, symmetry, alignment, the normal stuff, color, anything like that. And I don't see anything, so I'm just going to go ahead and assess cranial nerve 10, I believe. Yep, and that's the vagus. The vagus, so I'd ask her to say ah, and while she's doing that, I would check her uvula to make sure that her uvula is going upward as it should. Next, I check cranial nerve 12, which is the hypoglossal, and I ask the patient to move her tongue side to side, and if she does that with ease, then her cranial nerve 10 and 12 are intact. So next, I would assess the ears, and first I'd visually assess for any size, shape, symmetry, color, alignment, specifically the position, anything of that nature. And I don't see anything, so I'll go ahead and assess her cranial nerve 8, which is the acoustic, and I'll go ahead and do this by the finger test. So I'd ask the patient to close her eyes, and I'd rub my finger in one ear and ask her to tell me which one she heard it in. So she'd say her right ear, then her left. So her acoustic nerve is intact. Next, I'll go ahead and physically palpate the ear, the tragus, the auricle, anything for edema, nodules, any other abnormalities of that nature. Possibly look for any drainage or anything like that. So after doing the ears, I'd assess the neck. Yeah, the neck. So specifically what I'm looking for is alignment of the neck, alignment of the trachea, and so I'd visually assess that there's no abnormalities there, and I don't see any, so I'm just going to go ahead and palpate well, first I'll test her range of motion. I'd ask her to move her head side to side and maybe up and down, just to assess her range of motion in the neck. Then I would palpate the trachea for any alignment, any movement, which should not be there. And it feels fine. So I'll go ahead and assess the carotid pulse, which can be found on both sides. I'll do one at a time. And it's 2+ in bounding. It's 2+ in bounding. So next, I'll go ahead and make sure I'm also checking for equalness. And they were equal on both sides. Also, one thing I forgot is to check the temporal pulses, which should as well be equal on both sides. So next, I'll go ahead and auscultate her carotid pulses with the bell part of the stethoscope, just to listen for any bruits or swishing sounds, which I shouldn't hear. And I don't hear any, so. So once I've done that, I'm pretty much done with the neck. No, I'm not. I would assess cranial nerve 11. So I'd ask the patient to shrug her shoulders against resistance. And she does that with ease, so her spinal accessory nerve is intact. So once I'm done with that, I go ahead and begin by doing the interior aspect of her chest. And to do so, I'll probably remove the clothing. But, I'll remove the clothing. I'll go ahead and palpate for any abnormalities, any nodules, anything, any masses, anything that shouldn't be there, scarring, lesions, color symmetry, all that good stuff. So then I'd assess her APETM, which stands for the apical pulmonary. It'd be apical pulmonary Erb's point, tricuspid, and mitral. And normally I do it for one respiratory cycle and allow her to breathe in and exhale, but for time's sake I won't. And that's all good. I'd also find her apical pulse. So to do this, I'd find the angle of Louis, sternal notch, angle of Louis, find the second intercostal space, and I make sure to be on her left side. And I'd go down to the fifth intercostal space and go about midclavicular to find the apical pulse right there. And using this apical pulse, you could also find the pulse deficit. You could find the pulse deficit by subtracting a peripheral pulse from the apical pulse, such as the apical minus the radial pulse. So once I've done that, I'll go ahead and assess the anterior aspect of the lungs. And that's it for the anterior aspect, I believe. Let me look. Okay. As I do this, I would also assess the upper extremities, her arms. I'd visually assess for color, symmetry, shape, size, any masses, anything of that nature. So first I'd assess her What are you doing? I'd assess her nails. Oh my gosh. So I'd assess her nails specifically for color symmetry, any lines maybe, cap refill, which should refill in about less than 3 seconds on both sides. I'd also assess for any clubbing, so I'd make sure there's no bend, any abnormal angle there, which there isn't. So next I'd assess her range of motion by first asking her to squeeze my hands, but I'd ask her to squeeze my hands. She'd do that. I'd ask her to pull against my hands and push against my hands, and she does that with ease. So next I'd ask her to flex and extend against resistance. So if she could do that, then her range of motion is pretty intact. So next I would also assess skin turgor, which shouldn't tint, it should go right back down. There are 2 pulses in the upper extremities, so I would assess her radial pulse, which is right there, for 1 full minute, but I'm not going to do that. And next I would assess her brachial pulse, which would be about right there on both sides. So after that, after you palpate the pulses, I've already assessed her arms for temperature, anything like that, any abnormalities. So her upper extremity would be intact. And I've already listened to her lung sounds, her heart sounds, her apical pulse. And to do that, I'd find the apical deficit. I located the apical pulse, and now I'd move to the posterior aspect. So for this, I would just inspect it for size, shape, symmetry, color, any abnormalities, but specifically in the posterior aspect, I would check for spinal alignment, cervical, or this area, and I'd do the scapula. I'd check the scapulas just to make sure they're intact and make sure there's no pain there. So for the back, I'd assess, it doesn't matter which side, I guess, but front or back, you can assess the respiratory rate. So I'd ask her to go like this, breathe in, breathe out. I do that for much longer than I am, but for time I won't. So, or you can also assess her respiratory rate, her depth, rhythm, rate would all be normal in this case, and you can also assess it from the back, depending on which one. So I guess we can start by auscultating her lung sounds. And I wouldn't auscultate over the scapula, it's more so in between. So I normally do that for 1 full respiratory cycle on each location. Next, I'd go ahead and I'd ask the patient to lift up her arms or put them in front of her. So I could do the lateral lung sounds. And I'd make sure they're compare both sides. So while doing this, I should hear some of the normal lung sounds, such as bronchovascular, should be back here, bronchial, which would be on the trachea, vesicular, which would be all over her posterior aspect. And I shouldn't hear any crackles or any wheezing, anything like that. So once I've assessed that, I will also go to and assess APETM on her posterior side too. I believe so. You check the APETM on her posterior side. So it'd be A, P, Erb's point, tricuspid, and mitral. I do this for one full respiratory cycle, and that's the posterior aspect. Next, I go ahead and move on to the abdomen. For this part, I would lay her down. I would lay her down. Probably lift up her shirt so I'd visually assess, and specifically for the abdomen, I would auscultate first rather than palpating. So I do all 4 quadrants and start with the right lower quadrant. And I usually do this for much longer, but for time's sake, I'm not going to do that. So they all sound good. I can expect to hear normal vowel sounds. If I don't, it'd be probably hypoactive or hyperactive vowel sounds. So now I'll go ahead and lightly palpate each quadrant for any masses, lumps, or any facial grimacing or guarding. And I don't feel any, so I'll go ahead and do the deep palpation. And I don't feel any bulging, anything like that. So before doing this, I've already assessed that there's no pulsations in her abdomen, there's no bulging, nothing like that before even starting. So, and I also made sure there's no peristalsis visible, because none of that should be visible. So after doing that, I would palpate the inguinal region, which would be around this area, just for lymph nodes, any swollen lymph nodes. And while I'm here, I could also palpate her femoral pulse. So all of that is good. Next, I'll begin by doing the lower extremities. She can sit up for this one. So since the hair has hair distribution, I would check for hair distribution, alignment, symmetry, anything of that nature. I'd go ahead and palpate for any lumps, masses, anything like that. And while I'm here, I could also find the 2 pulses, the popliteal, which is behind her knee, And I could also find her dorsalis pedis, which would be on top of her foot, and her posterior tibialis, which would be inside the ankle area. And all of those are peripheral pulses, and they should be present and toothless. So after this, I would assess her muscle strength and also her dorsiflexion and plantar flexion. So to assess her strength, I would do one leg at a time, and I'd allow her to lift it up against resistance. And she should do that with ease, lift up against resistance, and she should do that with ease. So you could also do it the other way. That's that. And to assess dorsiflexion, you go make her. I'm out of breath. Make her feet go inwards to dorsiflex, and go outwards to plantar flex, and she should do that without ease or any pain. After doing that, so I've assessed her circulation and things of that nature. So I can also further assess her perfusion by assessing her cap refill, maybe range of motion in her toes, range of motion, or anything like that. So as with all things, I already palpated her temperature, palpated her skin for moisture, anything like that. So I think her feet are good. Yeah, so I think her feet are good. Next, I'll go ahead and finally assess her neurological, her neurological status. And so I'd ask her to walk, and I'd assess her gait, and I'd be checking for if she's off balance or anything like that, and if she walks with ease, without pain and everything. And she does. So next I'll test her balance by doing the Romberg's test. And to do this, I'd ask her to close her eyes. I'd assure her that I'm behind her, put her arms up, and she shouldn't move or anything too much. She should be balanced on both sides. So next I would assess her cerebral function, and to do that, I do the close the eyes, finger to nose test. And she should do that with ease and not feel off balance or anything like that. And that would indicate that her cerebral function is intact. Now, that is the end of my head to toe assessment. Miss Shortcake, did you experience any pain during this assessment? Hopefully she says no. Did you have any questions or concerns for me? This is me ensuring the comfort and safety of the patient. She says no. So this will conclude the head to toe assessment. And before leaving, I would again perform medical asepsis. And social distance. Looking back at the video, I did want to point out a few errors that I made during the video, but I probably won't be fixing for sake of storage because I don't have any. The apical pulse, I showed on the right side, but would be your left. But what I was trying to show is that it's on the left side. That's where you can locate the maximal point of impulse. And I think I also forgot to show the lymph nodes up here, which I'd just be feeling for any tenderness, swelling, anything like that. That would indicate infection. And I also did some of them out of order, like the nose before the ears,